Now, I'm very happy to introduce my most beloved friend, Petra Voiß. She's from Essen. She's the leader of the department there of the Integrative Oncology. And she was today with us in the workshop for the acupuncture, and she will have now, she will give us a lecture now about the microbiome. And I'm happy you're here.
Thank you very much for the introduction, and thanks a lot for the invitation. It's a wonderful place to be. I'm flashed by the lake, and I will do my very best to give this talk in English. When Dani asked me to come, she didn't tell me that I would have to give the lecture in English. Here are my potential conflicts of interest. And I want to go through with you through a few definitions. Microbiota is all the microorganisms in a habitat. Microbiome are all the microorganisms and their genome. And symbiosis is the physiological balance, and dysbiosis the imbalance. And mainly when we talk about the microbiota, we talk about the microbiota in the gastrointestinal tract. We do have the most data concerning that. But by now there must be around 100,000 publications in PubMed, and it's kind of hard to keep track on them. Quite a few are in the oncological setting, but other settings are also very interesting. And the intestinal bacteria, and we don't know a lot about viruses and fungus and archaea and all the other microorganisms. I'm talking mainly concerning the bacteria, okay? And we do have better opportunities to do research on the bacteria. The intestinal bacteria perform a variety of functions. They prevent the colonization of foreign pathogenic microorganisms as resident flora. And a high microbial diversity is very good for the health of people. And we don't know by now how a microbiome should look like, or what's the best microbiome to have. And it might be that it's different in every person. But to have a high diversity is very beneficial. And then the intestinal bacteria is metabolically highly active, and they produce short-chain fatty acids. And those are very important for our health. And lactic acid synthesizing bacteria like Bifidobacterium, they inhibit TNF-alpha secretion induced by lipopolysaccharides, and thus have an anti-inflammatory effect, and they stabilize the intestinal barrier. And also intestinal microorganisms provide metabolic pathways for the biosynthesis of vitamin K and various B vitamins. Usually the strains in healthy individuals are Firmicutes and Bacteroidetes. They make up more than 80%. And Firmicutes seems to be most important from what I've read about it. And it's so hard to do research on that topic because there are so many factors that influence the microbiome, and that makes it really difficult. We have diet and nutrition, obesity, hormones, aging, metabolism, genetic, epigenetic factors, medication, antibiotics, lifestyle and exercise. To do exercise really is good for the microbiome, probably because heating up the body. And the immune system plays a role. And this is one of my favorite pictures, which I show to the patients to explain why microbiome is so very important. And I try to motivate them to change their diet by showing this picture. You see the colon mucosa on the picture. On the left side, you see somebody who eats a lot of fiber with the diet. fiber is fermented by bacteria, and then short-chain fatty acids are produced by that. And also, if you eat a lot of fiber, the diversity increases of the bacteria. You really have a good mucosa layer, which is so important. I mean, you need to make sure the gastrointestinal mucosa is the first barrier of our immune system. And if it's a good layer, you have more protection. So that's very important. The short-chain fatty acids, they give ATP to the colonocytes. And the colonocytes are healthier if you have a lot of short-chain fatty acids and they have a good barrier function. So that's important for the immune tolerance in the lamina propria. On the right side, you see a patient with a metabolic disorder. That patient eats hardly any fibers. And you see there's almost none mucosa layer. And also it's reddened because there's inflammation going on. And also the immune cells are activated. And that plays an important role, for example, in graft versus host disease after stem cell transplantation. And also that might have to do with the response to checkpoint inhibitors. And let's look at the short-chain fatty acids. There are different kinds of short-chain fatty acids, and most research is done to butyrate. It's the end product of bacterial metabolism in the colon, and starch and indigestible oligosaccharides from dietary fiber are the main substrates of anaerobic microorganisms. About 98% of the bacteria are anaerobic bacteria in the colon. And here you see some of the bacteria that seems to be very beneficial. And it's the short-chain fatty acids are almost completely resorbed by colonocytes. And they contribute to improve the barrier function of the intestine by, among other things, stimulating the expression of proteins involved in the tight junctions. And they lower the pH in the colon, which inhibits the growth of facultative pathogens like E. coli. They also have an anti-inflammatory effect. They influence the pool of regulatory T cells in the colon, and they inhibit the secretion of pro-inflammatory cytokines such as tumor necrosis factor alpha and interleukin-6. And also they promote the biosynthesis of intestinal antimicrobial peptides. And there is a systematic review concerning gastrointestinal microbiota and breast cancer chemotherapy interactions, but there aren't very many trials so far. They included 9 trials, and so we don't really have clinical recommendations from this so far. They say studies concerning chemotherapy and the gastrointestinal microbiota demonstrate complex interconnections. The diversity of the microbiota seems to have a big influence, and also on response to chemotherapy and on prognosis. And also, it influences probably the development of side effects during chemotherapy. They say in high-risk patients, the addition of probiotic supplements may help mitigate anticipated side effects. But that's a tricky point, and I will explain that in a short while to you. And it might be that we have opportunities in the future to do a very personalized medicine by looking at the microbiota of patients. And now I want to show you some data from from the research group around Jennifer McQuaid from MD Anderson. And this is research mainly done for patients with melanoma. We do have more data there concerning checkpoint inhibitors, because that's the patient group where the checkpoint inhibitors started. And also a colleague from the United States who was into integrative oncology. He had a metastatic melanoma disease, and he took checkpoint inhibitors. And he got a microbiome analysis done, and then he took probiotics and took a couple of pills. And then he did again an analysis about 3 months later. And the diversity had decreased. And everybody was stunned by that. And that led the MD Anderson to do research on probiotics and cancer patients. And they looked at their oncologic patients, on their melanoma patients, and about 42% took probiotics. And that was really not good for the diversity of the microbiome. So that's why they started to do research on fiber-rich diet, probiotics, and checkpoint inhibitor in melanoma patients. And also, leading researchers met 2019 in Nepal, and they published their consents, or they published their discussion concerning checkpoint inhibitors and how to work with it. Several clinical studies have now suggested a role of gut microbiota composition in response to treatment, including anti-PD-1 therapy. Various approaches to render the microbiome more responsive to therapy have been suggested, including the use of antibiotics, probiotics, prebiotics, diet, and fecal microbial transplant. Future goals include the discovery of reliable microbiome-related biomarkers for prediction of response and stratification of patients, and the identification of favorable microbiomes. And although the microbiome appears to influence the response to immunotherapy, the factors that determine the microbiome and how patients can achieve a pro-response microbiome are less well known. And there seems to be little overlap in terms of pro-response bacterial species across the different cohorts. But the diet seems to have an influence. And most of the pro-response bacteria are fiber-fermenting bacteria. And that's why the colleagues discuss if it might be better to work through diet, to a fiber-rich diet, than to work with probiotics or other therapies like FMT. And they did the research on the melanoma patients, and they looked at the non-responder and responder, and Firmicutes and Faecalibacterium and Ruminicoccus are very enriched in the responders. And then they looked they developed 4 groups in this trial. And they took the stool of the patients and gave them to mice. And they did also studies with the mice. And those are the 4 groups. Sufficient fiber, and sufficient fiber means 20 grams of fiber per day. And insufficient fiber, no probiotics. Sufficient fiber, no probiotics. Sufficient fiber, probiotics. And insufficient fiber and probiotics. And as you can see, the survival probability in the dietary fiber intake and no probiotics use was the best. And probiotics might have a bad influence during checkpoint inhibitors by lowering the diversity. And when I visited the Congress of the Society for Integrative Oncology in New York in 2019, before I recommended the patients to take probiotics after chemotherapy to improve the diversity. But after the Congress, I stopped doing that. And there is a really nice podcast from the Society for Integrative Oncology from Jennifer McQuaid, which is from 2022, where she also explains a lot concerning the microbiome. And I think it might be better to recommend fermented food, because if you recommend fermented food, you recommend an ecosystem of bacteria. In probiotics, humans have put some bacteria which are beneficial, but that it's not an ecosystem. So it might be better to really recommend a fermented food and a fiber-rich diet. But we need more data on that. So far, we don't have enough data. And also, new medicine is produced which have a much higher variety of microbiota than the probiotics you can buy so far. In that trial with the melanoma patient, after adjustment for clinical factors, every 5 gram increase in daily dietary fiber intake corresponded with a 30% lower risk of progression or death. And also there is data from a Dutch group and an Australian group who compared the data with the American group with melanoma patients stage 3 who got a neoadjuvant immunotherapy. And they looked at the response. And the diversity wasn't that much different between the groups. But then they did 2 categories, beneficial or benign and adverse. In the adverse group, there were the patients who didn't have a response and who had immune-related adverse events higher grade or up grade 3 and higher. And here you can see there is a difference in the diversity. Also, the copy number per milligram FETSIS is different in the responder group and in the non-responder group. And the Faecalibacterium prasnitzi was higher in the responder group. And here are also 2 bacteria that might have an influence concerning response and non-response. And then they showed that omega-3 fatty acids correlate with diversity and also fiber, but the omega-3 fatty acids were higher in the correlation than fiber concerning diversity. And Ruminicoccacea, this is a bacterium that's always named concerning response in checkpoint inhibitors. So it might be a good idea to work with prebiotics, but I really like to recommend prebiotics through nutrition. And there is some data from the American Institute for Cancer Research concerning the systematic review that was published by the end of 2022. There is some hints that every 10 gram increase in fiber intake per day, a 13% lower risk of all-cause mortality can be achieved. And there were done 3 systematic reviews by the researcher groups from the American Institute for Cancer Research. And in this systematic review, all the 3 are published in one publication. So that might be of interest. But as the theme is so very complex, the data isn't so good so far. There are other data that probably it's good to eat 30 grams of fiber every day from prevention of cancer and cardiovascular disease. And I don't know if you have an idea how many 30 grams of fibers are. I didn't have any idea, but I'm fortunate the nutrition experts are in my team. So they did this slide for me. If you eat 4 slices of whole grain bread, you get about 16 gram, 3 potatoes, 3.5 gram, 1 apple unpeeled, raw raspberries, boiled beans, mixed salad with corn. Then you can get about 30 grams of fibers per day. Now, what's concerning probiotics? We have some data that it might decrease diarrhea and things like that. And it's really hard for me as a clinician how I should work with probiotics in the future. There is a systematic review concerning the effect of probiotics in breast cancer, and actually it's with 13 trials, and there is a little bit of data, but it's a high risk of bias that the intake of Lactobacillus bifidobacterium enterococcus, 3 capsules twice daily for 3 weeks, lead to a significant reduction in body fat and body weight, but a high risk of bias. And then there is some data concerning TNF-alpha. So it might have an anti-inflammatory effect to take a capsula with lactobacillus and bifidobacillus and plus a prebiotic. But the data isn't really that good so far. So my conclusion is diversity appears to be important for the tolerability, effectiveness of chemotherapy and immunotherapy. A well-tolerated, high-fiber, at least 25 to 30 grams per day plant-based low-fat diet is recommended. The use of probiotics is controversial, and many questions are still unanswered. Thank you for your attention.